PAI is Physiopedia's AI assistant, and it's about to become your new favorite partner in rehabilitation. Here's how it can help support your clinical reasoning, reduce your administrative burden, and ultimately deliver exceptional care. After logging into your Plus account, you'll find PAI at the bottom right-hand corner of the screen. Just click on it to open up the chat box. Here you can type in any rehabilitation-related question you want. Remember, the more details and context you provide, the better the answers will be. We'll start with a simple example. Which areas of the brain are affected by a left-sided middle cerebral artery stroke, and what are the implications in the context of occupational therapy? And PAI is able to give us exactly that. Notice that the answer is accompanied by the Physiopedia sources that the information is drawn from, so it's easy to double-check the responses. PAI also works well if you think of it as a mentor. Here's an example. I am a physiotherapy student. Could you provide a case study in an orthopedic setting so I can practice making differential diagnoses? PAI gives us a great case study example with all of the clinical assessment findings. Remember that if you want to continue in the same conversation so that PAI takes into account the conversation so far in its replies, you can just type your next question into the text box right after your previous question. If you want to start fresh, however, just hit New Chat. Let's stick with this case study for a moment and say we have an idea what this might be. PAI then gives us some useful feedback. You can keep discussing this case with PAI and ask it for more information, or start a new one. PAI's latest feature is Tasks, designed to simplify your clinical practice. PAI can help you draft a clinical SOAP note, discharge report, patient education guide, referral letter, or conduct a red flag check. Let's say we provide PAI with information about one of your new patients with lateral epicondylalgia, describing their clinical presentation and objective assessment findings. We are going to ask PAI to generate a SOAP note using this information. To do this, PAI may ask you for some more details. And now we get a nicely organized and detailed SOAP note. With the same patient case, we can ask for a red flag check, a patient education guide, a referral letter, or discharge report. With any of these, PAI might suggest further details that you can provide, and of course you can always ask PAI to change things to your liking. Finally, there are a few other useful buttons to note. The thumbs up or down buttons allow you to give us feedback on whether or not you were happy with PAI's response. This button allows you to copy the answer. History gives you an overview of all of your past conversations if you want to return to any of them. Search allows you to look for specific words in your past conversations, and Print gives you the option to print the conversation or save it as a PDF. This might be useful, for instance, if you are using PAI for a school assignment. PAI is also available in the Plus app, so you can access it on your phone wherever you are. Just open up the app and look for the assistant icon on the bottom menu bar. PAI is the only AI assistant that is rehabilitation-focused, designed by rehabilitation professionals for rehabilitation professionals. It's only available to Plus Pro and Full users, so join Plus, if you haven't already, to enhance your clinical practice and assist your studies.